The reason for the complement to be reduced is that as the complexes are formed, these complexes would associate with the complement fixation and activation will occur, and that would actually reduce the complement levels in the body. So hypocomplementemia occurs in type 3 reactions. So glomerulonephritis is one type of the issue that can occur. Then rheumatoid arthritis is another type, SLE is another type, then polyarteritis, nodosa is another type, then the allergic or hypersensitivity, allergic lung diseases is another type, right. So in here the drugs, we need to also understand what kind of drugs, so I will just put that out here. Penicillin are very common, then anti-thymocytes, and anti-thymocytes are given normally for the immunosuppression, anti-thymocytes. So these drugs, that drug actually goes and kills the thymus cells. So we are trying to reduce the thymus cellular function so that we can cause immunosuppression. So when that is given, normally this drug is made in the horses. So of course there is an antigenic preponderance there. So when this drug is taken, that can cause the antigen antibody complexes to be formed as well. So penicillin causes is anti-thymocytes cause it, then sulfamethoxazoles and other such drugs. Of course diphtheria, tetanus, trimethoprim. So trimethoprim, sulfamethoxazole, diphtheria's vaccine, tetanus vaccine, penicillins, for example, ampicillin administration, anti-thymocytes. These are the drugs that can cause antigen antibody complexes and cause a type 3 hypersensitivity reaction. Now just by the way, this is an USMLE concept here. Tetanus duration for the repeat injection is 5 years. So if the tetanus injection is given before 5 years, that can cause an Arthus reaction because the antibodies are already present from the previous dose. Now when the new dose is given, localized immune complexes will be formed and the soreness would occur. So back here in the pathology space, glomerulonephritis related to type 3 are of following types. We have IgA glomerulonephropathies or IgA nephritis. In this one what happens is, this is world's most common glomerulonephritis because of the autoimmune diseases, worldwide the most common. The cause is unknown. The symptoms in this particular case can range from no symptoms, asymptomatic, to a full blown renal failure. So that is one type, IgA. So what happens is that IgA complexes are formed onto the renal basement membranes. So that is IgA nephropathy. Then there is bacterial reasons. So there is the post-streptococcal glomerulonephritis, and normally what happens is that somebody nephritic sera of the streptococcus, that somebody was infected with that, maybe the skin infection or maybe the sore throat, and a couple of weeks later there is glomerulonephritis. So what happened was the antigens from the bacteria and the antibodies which body produced, those complexes went and settled on the glomerular membranes in the kidney, and these got complement fixation there and caused the local damage. So post-streptococcal glomerulonephritis, it's a very common USMLE question actually. Then bacterial infective endocarditis. And this is interesting that in case of infective endocarditis, there is, like this video and smash that subscribe button as well,
and make sure that you hit the bell button and get the notifications for the new videos in the future.